Okay, some of the companies have been given billions of dollars by the federal government. Is that an unfair advantage to somebody like you that's gotten, relatively speaking, a modest amount? Is that something you're worried about, or you don't care?
Well, I won't say I don't care. I have to manage a P&L, David. But at the same time, as I said at the outset, we want to be able to pursue this in a scientifically rigorous, orderly way. And so for us, we think if we're able to come forward with a vaccine, and we're confident that we will, we think the funding will eventually be there. So I don't think it's a disadvantage.
Okay, when you say you're confident they will come through, when is, I guess, the question you get asked all the time. When will there be a vaccine? At the end of this year, early next year, middle of next year?
Well, I won't speak to other people's vaccine programs, but what I would say is that we expect to go into human testing with our vaccines, both of them by the end of the year. What I can tell you is that the fastest vaccine ever developed was our mumps vaccine, and that took 4 years. So now we know that the urgency of the situation is going to cause us to try to move quickly, but never, ever at the expense of safety.
So human trials, do you mean phase 1, phase 2, phase 3? What phase are you in now?
Well, that's part of the way that I think people are thinking about speeding up the whole vaccine development. So for us, we're thinking about going into human trials. Often you can call those phase 1/phase 2 trials if they're designed in the right way. The FDA came out recently with some very thoughtful guidance. And what they've said, among other things, is that they wouldn't even approve a vaccine for emergency use unless there was 6 months of observation of data. So that gives you a sense that the fastest it could be is, let's say, a year from now.